Now, 2 more children have died in Bloemhof as a result of an outbreak of diarrhea in the area due to water contamination, bringing the number of deaths in the area to 3. Now, waterborne diseases such as cholera and typhoid are the diseases that are transmitted through drinking water. Now, the interruption of transmission is achieved by proper treatment of the drinking water itself. Now, for more on this, we're joined here in studio by Dr. Karen Keddy, the head and chief pathologist from the National Institute for Communicable Diseases. Doctor, good morning to you and welcome to AM News once again.
Good morning. Thank you for having me.
Now, we've seen the Bloemhof case and that's only one of the examples that is cited that we know of contaminated water in our country. Are there more?
We haven't been informed of any more currently, but there have been a number of outbreaks over the past few years where water treatment has failed, and there have been major outbreaks within areas in the country. We had quite a large one in the Northern Cape last year, for instance. Again, there was a problem with water treatment and most of the town was actually affected.
Just before we get to the further part of the interview, just give us an update on what's happening currently in Bloemhof.
Okay, at the present time what we've actually done is we've received a number of specimens that have been taken from patients in the area. We have looked fairly comprehensively at this, so we've looked for parasites, we've looked for viruses, we've looked for bacteria, and what we've actually come back is all 3 have actually been positive. So we found the parasites, we found a number of different viruses, and we have also found a number of diarrheagenic E. colis, which hugely suggests that is a problem of water contamination rather than a single source outbreak as you'd see in a foodborne outbreak.
So the good news is, though, it's not cholera.
The good news is it's not cholera. In fact, the excellent news is it's not cholera. And the reality is these pathogens are always circulating in the community. They do get transmitted, and the only way you're going to break this transmission is to make sure that people have adequate water and adequate sanitation.
Now, you did mention maintenance. Does proper infrastructure and maintenance thereof play a role in making sure that we don't have contaminated water there?
Infrastructure is critical. I think we're very fortunate sitting here in Johannesburg that we do have a very good infrastructure, and we do get some of the best water quality in the world, in fact, by international standards. Unfortunately, I think in the smaller towns, the problem to maintain when they're at a distance from Johannesburg is an issue. And even in those areas where they previously had working systems, if you don't put money into maintaining something, it's pretty much like servicing your car. If you don't service your car, the car breaks down. If you don't service your water treatment plant, they do eventually break down.
Now, you just mentioned it. At one stage, South Africa was one of the countries in the world, high-ranking countries in the world, where you could drink water from a tap anywhere in this country. Where do we stand right now?
I think our major cities, for instance, Johannesburg, Pretoria, Cape Town, PE, are still doing very, very well. I think in some of the smaller towns, in the more rural areas of the country, I think there are a few issues that need to be addressed. I think that what we really need to do is look at a very comprehensive treatment and possibly even education program, because the unfortunate reality is the health issue is the end stage issue. The real interventions need to come much earlier. It comes from Department of Water Affairs. Sanitation would be obviously the Department of Human Settlements and Sanitation. So it really is a very comprehensive and a very much networked approach that is needed between the different governmental departments to ensure that a community is safe.
So it's not just about water affairs, it needs to be an integrated approach to solve the situation.
It really does need to be integrated.
What are some of the contributing factors, though, that we have seen issues like happening in Bloemhof? We mentioned maintenance as one of them, but what other factors are there?
Other factors that might have contributed in Bloemhof is, I think it is fairly distant from any major towns and cities. I think this is always an issue in attracting and retaining well-qualified staff to do this maintenance. I think one of the issues as well that happened in the area is because it is near a major dam, possibly a lot of the problems is not just related to the tap water, but the fact that the community is reliant on water sources within the area. And I think the last major issue is sometimes when these things start so explosively, people are not really ready for them. And despite the fact that I know there's been very, very good campaigning by the Department of Health, trying to teach parents how to care for children with diarrhea, etc. Sometimes these messages get lost and people aren't quite ready for them. So when a child does get sick, does develop diarrhea, the parents are not as ready as they need to be to actually get the child to treatment as soon as possible and start treatment at home if necessary.
So it's all good and well to set up the infrastructure as well, but if you don't have the staff, the proper qualified staff to make sure that it's managed properly, you also have a problem.
That's correct.
Now, Doctor, at South African government, the current water situation, what can they do to assist with the situation, to make sure that we don't have contaminated water, such in the case as Bloemhof?
Well, I know the Department of Water Affairs has this program where they give a Blue Drop Award, whereby they actually will praise those municipalities and actually publish those municipalities that have a really, really good record. So, for instance, Johannesburg has a Blue Drop Award, Pretoria has a Blue Drop Award. And I think possibly what they need to do is roll out these programs and maybe even give incentives. Give incentives for people from Johannesburg to go and assist in the communities. I'm not really working with Department of Water Affairs. I work a lot more closely with the Department of Health. I know a number of people at the Department of Water Affairs, and I know they're very sincere about maintaining this. If things are not working, then possibly the thing to do is to step in from national government, say this is not working, we need to relook at it and bring in assistance from outside rather than leaving it in the hands of the local government.
Now, what is institutions like yourselves doing, National Institute for Communicable Diseases and the Centre for Enteric Diseases doing to assist government with that regard?
Our primary role in this is to advise the Department of Health where necessary on the management of patients, as well as to make diagnostics available for those pathogens that are harder for our peripheral laboratories to diagnose. And we have been doing this quite actively over the last week.
And just briefly, Doctor, for people in these rural areas where they have a water that maybe don't smell good and doesn't look good as well, what can they do to prevent from getting any diarrhea or any other diseases such as that we've seen in Bloemhof?
The major thing to do is actually to make sure that the water is treated. The easiest way to treat the water is to bring it up to a rolling boil. And if you boil it for a minute, you'll really get rid of most of the pathogens, including the parasites that may be in that water. Alternative methods would be filtration. And you can actually treat the water at home just with normal household bleach, adding basically a capful to a bucket of water. The exact scientific measurements would be 5 milliliters in 20 liters of water, provided the water has been properly treated and you've actually passed it through some sort of sieve to get out any detritus, organic matter, etc., where bacteria can go hide. The other thing that is very, very important is to start rehydration for people with diarrhea at home, particularly in the very young. And what we advise is normally in a very young child, if you basically give a cup of rehydration solution for each loose stool, it should be adequate. The advised rehydration is to take a litre of clean, safe water, so in other words, make it safe as I've just explained. Add to that 8 teaspoons of sugar, half a teaspoon of salt, mix it well so that the salt and sugar is dissolved, and just give that to the child with each loose stool. And that should be enough to keep the child rehydrated before they reach the clinic where they may then need or require intravenous therapy.
Dr. Keddy, thank you so much once again for joining us and giving us that advice.
Thank you.
That was Dr. Karen Keddy, the Head and Chief Pathologist at the Centre for Enteric Diseases and the National Institute for Communicable Diseases, joining us in studio.